Hey everyone, Dr. R here. In this video, we're going to talk a little bit about adult primary brain tumors. So in the last video, we talked a little bit about the pediatric variants of these. But in this video, we're going to focus on a few different tumors that we didn't talk about so much in the last video, just because these tumors are going to affect adults. And there are some key distinguishing features very similar to the pediatric brain tumors that we're going to hit on to make sure we can distinguish these in board questions. Now, as we talked about in the last video, there are some general rules that I just want to put out there. That way we can make things a little bit more simple. So number one, most of these tumors are going to be supratentorial. Again, here's your tentorium. Everything above the tentorium, right, is going to be supratentorial, and everything below the tentorium is going to be infratentorial. And classically, the things that are infratentorial are going to be things around the cerebellum, around the fourth ventricle. Now, there is an exception to this. The vestibular schwannoma is actually going to be infratentorial, and I mean, this kind of makes sense, right? Because, I feel like we talk about this tumor in every video, but the thing we always say about it is that it's in close proximity to the cerebellopontine angle. And remember what that says, cerebellopontine angle, right? We're near the cerebellum and the lateral pons, so we're in this area here. So the vestibular schwannoma, for that reason, is classically going to be infratentorial. The hemangioblastoma we'll talk about a little bit in a coming video. Like we talked about in the last video, these patients will have headaches worse at night or in the early morning. Usually it's progressively worsening. It's something that's happening over a long time, and when they're laying flat, there's this increase in intracranial pressure that's causing the headache. Primary brain tumors, which is what this topic is on, are talking about brain tumors that originate in the brain, okay? Now, when you're talking about brain metastases, right, when you're talking about mets, say a patient has lung cancer, okay, or say a patient has breast cancer, and the cancer spreads through the blood and it goes into the brain. In those situations, that's metastatic brain cancer, and that's not a primary brain cancer, okay? So in other words, it didn't originate in the brain. It originated somewhere else and spread to the brain. Now, metastases are the #1 cause of brain cancer, so it's even more likely that a tumor is going to be metastatic. Classically, metastatic tumors will tend to affect the gray-white junction. Okay, that's typically how it's asked about in board questions. But because this lecture is primarily focused on primary brain tumors, we're not going to talk too much more about the metastatic brain tumors. And one last cause of the metastatic brain tumors I just want to introduce here is melanoma. Okay, melanoma is probably, it's not the most common form of metastatic brain cancer, but it's one of the topics that gets asked about very frequently for some reason. And part of the reason might be because these tumors, because they're from neural crest cell origin, they stain S100 positive, as do other tumors that come from neural crest cells, like a vestibular schwannoma. All right, off the tangent, back on the main road here. So two markers I want you to be familiar with, GFAP and synaptophysin. So GFAP is a marker of glial origin. And now most of the primary tumors in the brain are going to originate from glial cells. The classic high-yield one is glioblastoma multiforme, which we will just abbreviate with GBM from this point forward. Now, technically, most different forms of adult brain tumors, like I said, can be GFAP positive, but one to remember that is not GFAP positive are meningiomas, because these are actually originating from the arachnoid tissue around the brain. Okay, synaptophysin is a marker, as is chromogranin A, and these are markers of neuroendocrine cells. Classically, you'll see these in like pheochromocytomas, neuroblastomas, also not observed though in meningiomas. So sometimes this comes up where they ask about markers, and just remember that these are not seen or observed in meningiomas.